Hello people. Now let's learn about the anti-malarial drugs. So the classification of anti-malarial drugs, four aminoquinolines which are chloroquine and piperaquine, while the sequiterpene lactones are these are artesunate and artemether, while the eight aminoquinolines are primaquine and the cinchona alkaloid is quinine and quinidine and the diaminopyridine is pyrimethamine. While the Plasmodium types, Plasmodium vivax, ovale, Plasmodium falciparum, Plasmodium malariae, and Plasmodium knowlesi, which is newly discovered. Now, firstly, the female Anopheles bites the person and the sporozoites goes into the blood. Quickly, the sporozoites goes to the liver. So here it goes to the liver where they either multiply or they go to the dormant stage. So they are multiplying here, and if they are not multiplying, they will go to the dormant stage, which is hypnozoid or the exoerythrocytic stage. Now the merozoites, they go back to the blood, but inside RBC, when RBC bursts, symptoms appear. So when they multiply, they form the merozoites, and these merozoites host the blood, but inside the RBC. And when they burst, the person suffers from the chills. Symptoms appears. Now, also gametes are also formed. So when they burst out, they also form the gametes in the blood. Now, the mosquito rebites and takes the gametes to form plasmodium. So, it has four stages. So, first stage is pre-erythrocytic stage. So, before going to the RBC, then is the exoerythrocytic stage, means the dormant hypnozoid stage. Then the erythrocytic stage means in the RBC, and the gametocytic stage means when the female Anopheles mosquito the gametes are formed, and that takes the gametes. Now, as I said, there are four stages: pre-erythrocytic stage, erythrocytic stage, exoerythrocytic stage, and gametogenic stage. Now, the pre-erythrocytic stage, there is casual prophylaxis. In the exoerythrocytic stage, suppressive prophylaxis and clinical cure is required. And in the exoerythrocytic stage, radical cure is required. Very important. And gametogenic to decrease the transmission. Now, cure is of clinical and radical. So, clinically, the treatment is erythrocytic stage, and the radically exoerythrocytic stage means that will treat the malaria and also stop the malaria from relapsing. Okay, so it won't that won't want to have the malaria reoccur or relapse. Now the prophylaxis, which is suppressive and casual. Suppressive means it suppress symptoms. Treatment is erythrocytic stage, and the casual treatment is pre-erythrocytic stage. Now, drugs given in pre-erythrocytic plus exoerythrocytic stage plus gametogenic stage is primaquine. And the erythrocytic stage, we are having two types: fast acting and slow acting. Fast acting, mefloquine, trick is machar, mefloquine, atovaquine, chloroquine, helofentrine, artemisinins, and rescue, which is quinine. And the slow acting are sulfadoxine and doxycycline. So chloroquine, which is drug of choice in malaria, and treatment is 600 milligram on the first day, 600 milligram on the second day, and 300 milligram on the third day. Now, the uses of chloroquine are trick is red lip Mahatma Gandhi. So, rheumatoid arthritis, extraintestinal amoebiasis, DLE, lepra reaction, infectious mononucleosis, photogenic reactions, malaria, and giardia. Now, side effects is bull's eye maculopathy, which occur if we use the chloroquine for 2 to 3 years, prolonged use. So, side effects is bull's eyes maculopathy, which occur 2 to 3 years prolonged use. Then it occurs, okay? Now, the artemisinins, these are fast acting, short acting, effective against MDR parasites. So, artemisinins are fast acting, short acting, effective against MDR parasites. These are artesunate, art ether, and artemether. So artemisinins are artesunate, art ether, artemether. So what does we mean by recrudescence? Very important term, recrudescence. It means incomplete treatment which leads to the reoccurring of malaria. So because of incomplete treatment, malaria फिर से हो जाता है. So what is ACT, which means artemisinin combination therapy. So artemisinin plus long acting drug is given in this. Drug of choice for chloroquine resistance. Combinations are lumefantrine plus artemether, which is drug of choice in northeastern states, and the artesunate and sulfadoxine pyrimethamine is drug of choice for rest of India. So the combinations are lumefantrines plus artemether and artesunate plus sulfadoxine pyrimethamine. Now the treatment of malaria under Nvbdcp, National Vector Borne Disease Control Program. So firstly the Plasmodium vivax malaria, chloroquine is given, and also the primaquine. So main is chloroquine, and in the first trimester we give chloroquine also. We can give the chloroquine. Now Plasmodium falciparum malaria, so we can give the ACT, which is artemisinin combination therapy, and in the first trimester if there is Plasmodium falciparum malaria, then we can give the quinine. And if there is mixed infection, so the ACT is given, and in pregnancy or first trimester there is quinine. And the complicated or severe or cerebral malaria, we give IV artesunate minimum 24 hours plus ACT. So and first trimester we also give the IV artesunate.